There are different stages of wounds as we classify them in medicine. Well, the first stage is stage 1. So what is a stage 1? Let's take a look at this. Well, this is a skin, all right? This little boxes is represented by skin, and you can see some redness right over the surface. So in order to categorize a stage 1 wound, it's an intact skin with non-blanchable redness over the bony areas. So this area right here is the non-blanchable area, so that when you actually push on it, when it means it doesn't blanch, that means it doesn't turn white when you touch it. Okay, that is the first stage of wounds. Now let's go to stage 2. Stage 2 is known as partial thickness, loss of the dermis, or a shallow open ulcer with a red-pink wound. So let's take a look at a stage 2 wound. As you can see here in the stage 2 wound, there's a partial thickness of the wound exposed, and you can see it's like an open ulcer. Alright, so that is a stage 2. The dermis is already being lost in stage 2. That is the key characteristic. Now, let's take a look at a stage 3 wound. In stage 3 wound, we now have a full thickness or tissue loss, including subcutaneous fat, which may be visible. But the key thing is, in stage 3, there is no bone, tendon, or muscle exposure. So let's take a look. Remember, the skin has the epidermis, the dermis, and the subcutaneous fatty layer, and then you reach the muscles and eventually the bone. So in stage 3 wounds, okay, so it's a full thickness. The full thickness, the epidermis, okay, is gone. We're down already to the dermis, and we're down to the yellow portion, which is the subcutaneous fat. Okay, that is known as a stage 3 wound. Okay, now let's go to stage 4. Now in stage 4, we have a full thickness tissue loss with now bone exposed, or tendon, or muscle. Now the issue is there may be tunneling. Now what is tunneling? Let's take a look here. We've got the epidermis, the dermis, as you can see, the yellows, the subcutaneous fat, and some of the muscle tissue is already been exposed. All right, so, and also there could be tunneling. Now tunneling, as you can see in this demonstration, is that there's actually a hole that's forming a tunnel inside the wound. Okay, that's a stage 4 that could be causing a stage 4 wound. As you can see, that's a whole tunnel, so you want to make sure that is not present when you're staging the wound. And also we have unstageable wounds, which are basically a full thickness tissue loss in which the base of the wound is covered by a tan, gray, or a brown or black eschar. So this is representing a black eschar. That is not a stageable wound, okay? That is an eschar, a black eschar kind of forming right over the wound. That is known as an unstageable wound, okay? So now we can also have finally a deep tissue injury. In a deep tissue injury, the difference is you've got a purple or maroon area of discoloration, intact skin, or blood-filled blister. So this is an example of a deep tissue injury. You kind of see some purple discoloration on the skin, but it's really, really deep. But the skin kind of looks intact. So to kind of wrap it up, okay, this is all our wounds. We've got stage 1, stage 2, stage 3, and stage 4. And this is how we classify wounds. If you like this video, please click the like button, or also subscribe to my channel. Also visit my website, www.ftplectures.com. Thank you very much for watching. Again, it's Dr. Adesina. Have a wonderful day. Bye-bye.